Welcome to MBLEx exam practice test. Our topic today is guidelines for professional practice. Use the link in the description to download the app on the App Store for free practice tests. Number 1. Which of the following is true regarding tipping? A. It is considered unethical. A therapist should dismiss clients who offer them tips. B. It is a necessary percentage of any LMT's income. Calculate all wages plus 20% in tips when considering a new job. C. It is more common in spas and hotels than medical clinics. D. It is an accepted practice, but therapists should refuse them if trying to be professional. The correct answer is C. It is more common in spas and hotels than medical clinics. Explanation. It is more common in spas and hotels than medical clinics. Tips are always nice, but a therapist should never depend on them for income. Clients are changeable, sometimes the same person will tip generously on one occasion and not at all on another. Clients generally assume that tips are inappropriate in medical settings. Some doctors agree and discourage clinical LMTs from accepting gratuity. Number 2. How likely is it that an employer will require a practical interview? A. Very unlikely. Practicals are going out of style. B. Very likely. In fact, the therapist should be wary of any interviews that do away with the practical component. C. Very unlikely. It is awkward to see a potential employer naked. D. Very likely. It is customary for the therapist to work on an easily accessible part of the body, like the hands or feet. The correct answer is B. Very likely. In fact, the therapist should be wary of any interviews that do away with the practical component. Explanation. A practical interview is an essential part of any hiring process. The therapist should come prepared to perform a massage on their potential employer. This can be an awkward dynamic. The therapist's confidence under that pressure is a determining factor in whether they will get the job. Number 3. Which of the client's bodily fluids should the therapist avoid, according to standard precautions? A. Blood and pus only. All other fluids are safe, as long as the therapist has no open wounds and washes their hands immediately. B. All bodily fluids, including but not limited to blood, sweat, tears, semen, vaginal secretions, mucus, saliva, and pus. C. Most bodily fluids, including blood, sweat, semen, vaginal secretions, mucus, saliva, and pus. D. Most bodily fluids, but not including sweat. The correct answer is D. Most bodily fluids, but not including sweat. Explanation. Standard precautions state that the therapist or other healthcare provider should avoid contact with most bodily fluids, such as blood, mucus, semen, vaginal secretions, saliva. Sweat is not considered an infectious bodily fluid and will likely be encountered during massages. Number 4. What is acupuncture? A. A recently developed style of bodywork that involves placing needles in tight muscles to release physical tension. B. An ancient form of medicine developed in India. C. An ancient holistic modality that involves placing needles at specific points in the body. D. A recently developed Eastern modality intended to alleviate anxiety by releasing endorphins. The correct answer is C. An ancient holistic modality that involves placing needles at specific points in the body. Explanation. Acupuncture is several thousand years old and was originally developed in China. Acupuncturists place needles at specific points in the body, prescribe herbs, and monitor their clients' progress. This is a holistic modality intended to treat body and mind together. Number 5. A therapist is trained in aromatherapy and keeps essential oils on hand for use during treatment. A new client complains of intense anxiety. The therapist believes aromatherapy can help. What is the best course of action? A. Use the proper essential oils during massage without mentioning it to the client. Asking too many questions will just make the client more anxious. B. Explain the history of aromatherapy and the client's different options. The client can only make an informed decision if they understand every detail of the recommended treatment. C. Offer the client one or two options after asking about any allergies they have. Then just go with whichever one you feel is best. D. Prescribe lavender. It will alleviate the client's symptoms. The correct answer is B. Explain the history of aromatherapy and the client's different options. The client can only make an informed decision if they understand every detail of the recommended treatment. Explanation. Informed consent is an important component of treatment, and the therapist should educate clients about new modalities. However, the therapist should bear the client's needs in mind. Some find it easier to follow an LMT's advice when they understand why it will help. Others prefer to follow simple instructions without worrying about the details. It is best to offer clients enough options so they can make informed decisions, but not so many that they become overwhelmed. Remember that, as a therapist, one cannot legally prescribe any course of treatment or medication. Number 6. Which of the following massage techniques can elongate the joints? A. Myofascial release. B. Traction. C. Cross-fiber friction. D. Rhythmic compression. The correct answer is B. Traction. Explanation. Tractioning techniques elongate the joints, most often the spine. A chiropractor's office might have a traction table, for example. This machine is not unlike the massage chairs in a nail salon, except that it is much more clinical and specific. The client lies supine on the table, the doctor sets a timer, and a pin moves along the client's spine for a set amount of time, usually from 5 to 7 minutes, releasing the erector spinae. Traction can also refer to manual techniques employed during a massage to lengthen the torso or a limb. Number 7. Which of the following is a type of energy work? A. Cryotherapy. B. Aromatherapy. C. Sports massage, particularly pre-competition. D. Reiki. The correct answer is D. Reiki. Explanation. Energy work is a catch-all phrase used to describe any modality where the practitioner focuses on manipulating the client's alleged energy. Reiki is a popular form of this. Aromatherapy uses essential oils and scents to achieve physiological effects, but it is not a form of energy work. Number 8. What does Prom stand for? A. Pain-free range of motion. B. Painful range of motion. C. Prone, range of motion, optimize, manipulate. D. Palpate range of motion. The correct answer is A. Pain-free range of motion. Explanation. Prom is an acronym therapists use to teach clients how to do certain rehab exercises. It is a more formal way of reminding them, try this exercise, but don't go too far. If it hurts, stop. Number 9. What is a deductible? A. The amount of money an insured client is expected to pay for one office visit. B. The amount the insurance company pays after receiving a claim. C. A set amount of money that the client must pay before their insurance begins to cover the costs of care. D. The maximum amount of money an insurance plan will allow a patient to pay for care in a given year. The correct answer is C. A set amount of money that the client must pay before their insurance begins to cover the costs of care. Explanation. Insurance plans that have a low premium, the patient's monthly cost to carry the insurance, tend to have a higher deductible unless most of the cost of the plan is covered by the patient's employer. High deductibles can be a barrier to patients seeking the treatment they need because they are responsible for all billed amounts until they've exceeded their deductible, after which point, the insurance coverage will start to kick in for services. Choice A refers to a copay. Choice B describes the insurance payment for a given procedure. Choice D describes the out-of-pocket maximum. Number 10. Which of the following bodywork techniques or modalities is used primarily to treat back and neck pain? A. Reflexology. B. Tractioning. C. Reiki. D. Cryotherapy. The correct answer is B. Tractioning. Explanation. Contractioning techniques elongate the joints, most often along the spine, to help relieve back pain caused by muscle spasms, disc compression, or disc injury. Choice A, reflexology, is incorrect because this style of massage is applied to the feet. Choice C, Reiki, is a form of energy work that is not specific to the back. Choice D, cryotherapy, involves the application of ice or ice packs to acute injuries to control inflammation and decrease pain. While cryotherapy may be implemented with low back pain, it's not specific to back pain. In fact, cryotherapy has applications for many musculoskeletal injuries and pains, from foot issues to shoulder injuries. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.